Hi, my name is Drew, and if you know me at all, you know it's hard for me to make decisions, especially with my career. It's like the biggest thing I talk about with my therapist. But we're trying to fix that today with I Want to Be. And this week, I want to be a phlebotomist. I'm talking with my good friend Kylie, who's been a phlebotomist for over a year. She's gonna show me the ins and outs of what it's like to be a phlebotomist and see if it's the right thing for me or for you guys. So saddle on up and enjoy the ride. We're here. We're starting the podcast now. How does it feel to be interviewed a little bit?
A little weird. I don't think I've ever been interviewed before, so
Except for jobs.
yeah. But then that was more high stakes, like, I gotta be my best behavior.
You don't think you have to be on your best behavior here?
No. I mean, a little bit, but not as much as a job interview.
Okay, well, I guess we should introduce ourselves before we get started. I'm Drew.
I'm Kylie.
And to just start it off, tell us a little bit about who Kylie is.
Okay. I'm 25. I am a nursing student at Cox College, and I work for Cox North Hospital as a phlebotomist.
Ooh, so what got you into phlebotomy?
I had some friends who were in it a long time ago whenever they were in nursing school, and they talked about it and it seemed fun. So whenever I got into nursing school, I was like, let's try phlebotomy just so I can get my foot in the door to work at the hospital.
So it's more of like an entry level job then?
Yeah, like you need a high school diploma.
Okay.
They would like you to have more work experience, but I had never worked in a hospital before and I got hired. So
There you go. You just crushed the interview.
yeah, that was it.
So they want you to have work experience. How do you get work experience if you don't have any experience to begin with?
Yeah, I don't know. That's why North took me. I actually applied at Cox South also, and they did not accept me. So then I interviewed at North, and they said, yes, we'll take you. So.
And then you're in.
Yeah, and then I'm in, and now I have work experience, so I can work other places. You just got to get that first person that will be like, I'll take a chance, I guess.
Are there any like training programs you can do?
Yeah, there's classes too you can take and become a certified phlebotomist. A couple people in the lab actually have that, but I don't know how any of that works because I didn't do it. So.
Do you think it's worth getting the certification?
I think you get paid a little bit more. But I do the same job as them, and I just learned on the job. I don't really like school, so I would not suggest it. But if you like school, I guess.
Do you know how long the training process was?
I think one girl did it, and I think she said it was like 6 months to a year or something like that.
For phlebotomy?
I think. I'm not 100% sure. It might have been less than that, but she doesn't work there anymore, so. So I can't ask her either.
That's crazy. That was 6 to 12 months, or you can just learn on the job.
Yeah, like a couple days. My first day, they were like, are you ready to stick someone? And I stuck someone, so.
Like an actual patient?
No, it was our manager, our boss. She's like, you can practice on me. So I did.
How was like the first day going from zero experience into stabbing someone with a needle?
Well, they give you a fake arm to use first. So, like, you learn how to hold the needle, how to, like, position it and everything like that. But, like, a fake arm is way different than a real person. My first person, though, he was, like, a young guy, and he had, like, thick veins. So I was like, okay, I can do this one. Let me do him. So it was still scary because you're stabbing someone with a needle, but you just have to, like, get over that and be like, okay, act confident so the patient doesn't get scared.
Do people come down with you when you're doing it your first time, or are they just
yeah.
Okay.
Yeah, they were standing right there. They were in the doorway because my first patient was a psych patient. So he was chill, though. He wasn't like psych patients aren't crazy like you think they would be. They're just sad people, usually depressed. But he was fine. He was just sitting there, and then my trainer was standing at the doorway in case I needed anything.
Cool. So with your patient population, you typically deal with psych patients?
Mm-hmm. Yep. Cox North is ER and psych patients. So most of the time we're drawing on psych patients because they don't get IVs or anything like that. So they can't draw the blood from them, so we do it. But like I said, they're not usually crazy, like actually crazy. They're just sad people. which I thought when I first started it was going to be, like, they're like, you're working with psych patients. And I was like, oh, they're all like movie crazy, like in the movies where they're like hitting their head on the wall and stuff. And of course we do have some of those people, but like 1% out of everybody that we
Okay.
get.
That's a little less scary and a little less
Yes.
intimidating.
Yeah.
If you do have those people that are like banging their heads against the wall and they need blood, how do you go about getting that?
Well, usually the nurses will be like, if I come down and the patient is too wild for me to draw their blood, they'll be like, we're gonna give them some medicine and then we'll let you know. Or they restrain them, like in restraints, and then I have
Oh,
to get the blood from them while they're in restraints, which sometimes is kind of scary and hard because sometimes they spit too, so they put a spit guard on them, so it's covering the whole face so they don't spit on people. And I mean, while they're in restraints, they're still like moving their arms and stuff, so someone usually, like a security guard goes with me in the room, but usually they're still moving their arms and stuff, so someone has to hold their arms down while they're still in restraints so I can draw them. So then I feel bad for the person having to hold them down because I'm like, okay, I need to get the first stick. I need to get their blood, make sure. So it's kind of nerve-wracking, but kind of fun too.
do you remember like the first time you had to go and do that? What was that like?
Like while they were holding them down.
Mm-hmm.
Yeah. It was this really, really tiny, skinny girl. She was in her like 20s, I think. But she was like, you're not drawing my blood. She was cussing at everybody. And then the nurse was like, you can either do this, let her do it, or we're going to hold you down. And she was like, F you. And so, like, it felt like 10 nurses all came into the room, and it's a small room. They all came down. There was like people holding her legs down, people holding her arms, people holding her shoulders. Like, they were holding her down, and they're like, come draw it. And I was, of course, scared because I was kind of new. And I remember she was just so skinny and tiny, and they were holding her arm like almost off the bed. And she was just so tiny that I was like, they're gonna snap her arm. Like, that's what I thought. I was like, this is so gross if her arm breaks right in front of me. Um, but she was so little that her veins weren't very good. So I only got a little tiny bit of blood, and the nurse was like, can you put it in cappies, which are like pediatric tubes, if you can't, like a heel stick, if you have to do a heel stick instead of a venous draw out of the vein. It's just less blood, but they can still do the same tests on it. And I was like, yeah. So I went and did that and put it in there instead, and it worked, thankfully. But that was my first, like, they're holding people down and I'm scared. And she was screaming, and she also was grabbing me, like, because nobody had her hand, just her arm was down. So she kept grabbing my stomach and like trying to scratch, and the nurse was like, do not grab her. And I was like, oh my gosh. I was shaking afterwards.
I would be too.
Yeah, it was wild.
So like potential assault, something you have to deal with as a phlebotomist?
I would say not as much for phlebotomy as nurses. And like usually if they know a patient is gonna potentially assault someone, they always call a security guard and they'll be in the room with you. So if anything happens, they're right there. But I feel like phlebotomists are pretty safe in that aspect. Like, I mean, of course, there's always potential to get assaulted, but less than other healthcare workers.
Okay, that's good. A little comforting.
Yeah.
You mentioned a heel stick.
Mm-hmm.
What does that entail?
So like babies, whenever they come in, if they're just a couple days old or a couple months old, instead of drawing from their vein, we will do a little heel stick. We just basically have, I don't know what it's called, but the little thing that you push and the needle pokes them and then it goes back in. I don't know what that's called, but we just heel stick them on their heel. Little needle goes in and then their blood comes out, and then we just drop their blood into little tubes.
Wow, that. See, when I thought about phlebotomy, I didn't think of like babies. Is
Yeah.
that something you have to deal with a lot?
Not a whole lot at North, but it's outpatients, patients that come in that just need their blood drawn, like they're not a patient or anything. It's usually babies that are like, oh, we need their blood drawn because a lab came up after they were born that was abnormal or something. So they're just testing it again or something like that. So not too often, but often enough that I don't want to have to do it anymore because it's sad for babies. And the parents are usually like, oh, you have to stick them again, because sometimes it doesn't work the first time, just because heel sticks are harder than venous draws.
So when you deal with those types of parents that are like almost non-compliant, how do you deal with that?
Honestly, I'm just like, yeah, I'm sorry that we have to do this. I try to get it done, obviously, the first time every time, but sometimes it just doesn't work like that. So you have to like put a brave face on and be like, okay, sorry, we're gonna have to do it again. And usually you can just tell they're upset, but most of the time they know that it has to be done. I have had one person walk out with their baby. They're like, no, you're not doing it again. And so they left. I don't know what happened to them if they ever did come back, but yeah, they left. They were like, I'm not doing it again. So
They walked out on the draw.
yeah, like I drew them one time. I poked their heel. I got the blood, but it clotted before they could run the tests. So I came back in and I was like, hey, we're going to have to re-stick them. And she's like, no, we're going to go. I was like, okay. Because I mean, everybody has the right to refuse, but.
Do they have a right to refuse in the ER too?
Yes, in the ER they do. As a psych patient, they do not. Like psych patients, if you're in there and you're like on a hold, like you can't leave if you want to by yourself. They are, because some of them try to say no, some psych patients try to say no. They're like, no, I don't consent to that. And I was like, well, you don't have the option. I'm sorry. I try to say it in a nice way, but I'm like, well, we have to do it. Like your doctor ordered it, so sorry.
When you're dealing with like kind of the harder sticks, do you have any tips for like hitting those veins?
Oh, it kind of just depends on like patient to patient how it goes, and really you just have to like do it for a little bit to understand like what you're supposed to do in certain situations, because some people just have really surface veins, like they're more towards the top, and they're like little old ladies, they have surface veins and they're very small, so you just have to go in like you're barely putting the needle in and you're being very slow with everything so it doesn't blow the vein. But yeah, it just depends, because you can also like you've moved the needle around in before
While drawing you.
yes, yeah. So some people, like whenever you were doing that, I didn't feel anything. I didn't feel anything besides the initial you poking me. And then after that, I didn't feel anything. But some people will say like, I can feel you moving the needle. It hurts. And of course, everybody's different. So they could be feeling it, but it's just interesting because like I couldn't feel.
Do I need to go down more?
I don't know. I can't tell without me doing it.
I was gonna say, let me glove up real quick, Jody.
Yeah, you might need to angle down just a little bit.
Can I palpate you, Kylie?
Yeah.
It definitely runs more sideways. What I would do is I would pull back a lot, but not to where the needle comes out, because sometimes you don't realize. And once you're pretty far back,
And you can feel with your other finger if you need to how deep the
Yeah.
needle is.
like you can still
you feel
pull
the
back
needle?
a pretty good amount, to be honest.
You can push harder than you think too. Okay, I'd stop right there.
Yeah, and now slowly turn that way.
Okay.
Just this hand. Just try and like
Yep, there you
sweep
go.
it. Good.
Around here?
Yeah, and
Yeah.
now go in
Just a
slowly.
little. Having the sweeping motions really helps.
There you go.
Because a lot of times people will like slowly scoot it, and that's what really hurts. You have
Yeah.
to like sweep it. Look at you go. Yay!
And then you draw like that.
And do you know what you would do if I started passing out?
Let's not freak him out.
What would I do?
Stop taking the blood. Take the needle
Okay.
out. But hopefully nobody passes out on you. Okay.
Hopefully
You
not.
only want that much?
So
So
first,
then
before you take it out,
Tourniquet?
yep, good job. A lot of people forget the tourniquet. That's their big thing.
When I got
That's what
trained
hurts
at
the
Sal,
most.
the guy
And then I would
was
get
with
your
forgot it every
needle.
time.
Or not your needle, your cotton ball, sorry. Yep, and then take it out. But don't push down until you take it out.
Okay.
Good job.
Mhm.
I'll hold it for you.
Thank you.
So I'm always like, all right, can you feel it? Which I believe them because I don't know how they're feeling, but yeah. How did you feel about poking and moving the needle around and stuff?
I was very nervous doing it my first time. like practice a little bit on the dummy,
Mm-hmm.
but then you're like, okay, I want to do this into a person.
Yeah.
And I've gotten my blood drawn before, so I know how bad it hurts sometimes.
Mm-hmm.
At least like the first
The initial
poking.
poke.
Yeah, the poke part. And then when I didn't get it, that's when I was like, okay, we're done here. We're not doing this
We're
anymore.
done.
And then you're like, no, dig around a little bit. Do a little bit of digging.
Yeah.
And when I've restrained some patients, especially like the children, the moms are not a fan of the digging.
No.
They don't like that.
Yeah, they're not.
So you don't tell the patient that you're digging, you just kind of...
Yeah, I just move it around. And it's not like you're doing it like quickly and intentionally to hurt them or anything. But I would rather someone poke me one time and then move the needle, even just a little bit. Sometimes it only takes like, oh, you're just not in all the way or something like that into the vein all the way. So it only takes a little movement and then you'll get it. But some people are like, if you don't get it on the first time you go into my skin, just take it out. I'd rather you re-stick me than dig around. So, I mean, that kind of stinks sometimes. It's not a big deal because, I mean, whatever. But I'm like, but if I just move it just a little bit, it might be in. So, but it just depends patient to patient.
How many times can you stick a patient before they're like, I'm done?
Well, I mean, some patients have gotten stuck a lot. Like the nurses try to do IVs on them like 4 times and they call us and then we might stick a couple times. For phlebotomist in like the North lab, we say one phlebotomist can stick 2 times before they need to get somebody else to try and stick them. Which sometimes I've done 3 times if I'm like, okay, this one I think is going to be good. And then sometimes I get it, sometimes I don't. But sometimes, like last night I worked and I actually said to a patient, I can only feel this one little tiny vein. I'm going to try it. If I can't get it, I'm going to get somebody else because I'm not going to stick someone just randomly just to say I stuck them. So 2 times is usually the max for phlebotomy, but I've seen people, especially if you have to get their blood, like they get stuck as many times as it takes until you get it.
And that's not just where we typically see blood getting drawn by the elbow.
In the AC area, yeah, like where your elbow bends. Yeah, that's where we like to look first, especially in the ER and as phlebotomists. But I think that they said phlebotomy, we can look from like the AC down all the way to the hands. We'll do hands. And then if we can't find anything there, we look on the other side, obviously, too. We go up the arm more towards the bicep area. We can look there. We do the wrist sometimes. That's like my very last resort because everybody says it hurts really bad. And it's just, there's so many tendons and important things there. I don't want to do that. But if it's like bad, I've never had to do it, but you can do the feet. But you have to get a doctor's permission to do that in case they have diabetes. Because usually diabetics can't like feel their feet. So if they start getting like a wound there and they don't check their feet, it can be really bad, like cause amputation eventually. But yeah, hopefully not from just a little needle stick, but it could happen. So you have to get a doctor's permission before you do the feet.
For the doctor's permission, is it you saying, hey, can I stick their feet? And they say, go ahead. Like
I said, I've never done it, but one time somebody did, like the nurse was like, you can stick feet, right? And I was like, I have to get a doctor's permission. He's like, yeah, I'll give you permission. So I guess it's even a nurse maybe, but I don't know. Because I didn't end up having to do it, so I didn't get into it too much.
Wow. It doesn't seem like there's that much paperwork involved with the whole phlebotomy thing.
No, there's not. That's all the nurses, thank goodness. Yeah, we just draw, we get the blood, we label it, and then we give it upstairs to the techs. And then they do whatever they do with the blood.
So that's good. I guess for someone that doesn't want to deal with a lot of documentation, phlebotomy might be a good job for them to have.
Yeah. I know at South, phlebotomists only draw, like they only go to patients and draw their blood. But at North, we have a whole lab, so we're smaller than South is. So we get outpatients too, and we do have to deal with their paperwork just a little bit just to figure out what they need drawn, what the doctor has ordered. But then Like we get specimens from other, like the Greene County Jail. We get their specimens, so we have to deal with their paperwork just a little bit. Stuff like that, but again, it's not too much.
So I guess what are some other good things about phlebotomy? If you're trying to sell someone on being a phlebotomist, what's your pitch?
I would say it's definitely good patient interaction for sure. Especially if you're wanting to do something else in healthcare, this would be a good job to start out as because you're talking to patients and you're touching the patient. Because sometimes whenever you're first ever touching somebody else, especially someone you just met, like you're like, "Hi, I'm Kylie. I'm gonna be taking your blood today." It's really awkward to touch someone like a stranger. So it would be nice to have that experience before you go into something else like nursing, because you're already going to be comfortable touching strangers and talking to them. So
you get a lot of talking, a lot of touching going on there. Is that kind of you're doing nursing, obviously? Has that been like a smooth transition for you
into nursing,
Mm-hmm.
yeah, I definitely feel more comfortable like talking to patients, and especially because some patients will say off the wall things, and at first you like when you first start you don't know how to answer. Like if you're like, "How are you doing today?" and they're like, "I'm horrible. This is rough." Like they're just going on and on about how horrible their day is, and you just like at first you're like, "Oh, well," like you don't know what to say, so you just get more used to saying stuff like "that stinks" and then like moving on. Like you don't, I don't know. I think it's just weird at first to hear people talk like that, and then you're fine. But and then touching the patients and stuff like that, yeah, you just get more comfortable. You're like, "Okay, well, this is what we have to do." Like, especially nobody likes getting stuck with a needle. So when you have to do another procedure that's maybe uncomfortable, it's like, "Well, this is what we have to do, so we're gonna do it. So we're gonna try and get it done as fast as possible." But and then it's just easier to like tell the patient what we're doing instead of being like, "Can we do this?" Like, because at first I feel like I especially was like, "Do you care if I do this?" Instead of being like, "Hey, you're at the hospital. We need to do this. This is what we're gonna do." Of course, they can always say no if they don't want it, but yeah.
Makes it to where there's less pushback when you're doing the draws.
Yeah. Especially if you act confident. If you act confident, I feel like people are very like, "Okay, do whatever you need to do."
Just be there with a straight face. You know
Well, you
what
can
you're
smile, of course, be like friendly, but you need to be like firm about it. Like, "Hey, I'm here to draw some blood. Which arm do you want to use?" Like, you give them a choice, but it's not really like you're saying, "I'm drawing your blood. You don't get a choice in that," which of course you do all the time. You can say no, and I won't draw it. But saying like, "Which arm do you want me to use?" Because then they're like, "Okay, I do have a choice. Which arm do I want to use?" Giving them a little bit of choices.
And for people that can't see, you are pregnant. So how does that work into being a phlebotomist?
I've had a really good pregnancy so far, so really, I don't know, there's nothing. And I feel like I just started showing more, so usually people don't even, like, there has been one girl who was like, "Are you pregnant?" And it was a patient. And I was like, "Yeah." And so we talked about it a little bit, but other people who've been pregnant, like there's a nurse, Kaylee, who was pregnant, very visibly so. I guess other, like, patients would be nicer to her because they are like, "Okay, yeah, like, do what you need to do," and they're easier on her. That's what I've heard, not from her. So I don't know if that's true or not, but I feel like people are more sympathetic to pregnant women, so
Oh, for sure. I feel like if I was pregnant, I'd be worried about the baby the whole time when I was doing like the crazier restrained draws. Is that something that you feel like you've been more concerned about?
Well, actually, I went to go draw a patient, and I was standing outside their door, and the nurse for the patient was outside the door, and I was like, "Hey, do they need a blood draw?" And she goes, "Yeah, but you're not gonna do it. Go get somebody else to do it because he's kind of reckless, and in your condition, meaning pregnant, like you don't need to be doing it." So I feel like the nurses are pretty aware too, and they are like, "We'll do it before you're gonna do it." So they protect in that way too, which is really nice.
Yeah, you don't want someone like grabbing after your baby or anything
Yeah, or
like that.
kicking me in the stomach or something. Like that's happened before, you know.
You've been kicked?
Not me, but one of my friends is an EMT, and she said she had an EMT that was pregnant, and they were trying to get someone onto a gurney or something, and they kicked her in the stomach, and she actually ended up losing the baby because of it. So
Wow.
yeah.
So I guess going on to the other fields, would you recommend like EMT or CNA or ER tech or anything like that over phlebotomy?
Well, with most of those, you have to be certified. You have to go, like EMT, you have to go to school for it and get a certification and take like a state test for it. So, I mean, if you're just looking to get into it, just get your foot in the door. I had a high school diploma and I got in. So, easier than having to go to school first. But like my friend is in nursing school. She's an EMT, so she knows a lot already. So if you're wanting to advance like that, it's probably good. But if you're just trying to get your foot in the door, I would say just go with phlebotomy. Which I think techs, you don't have to have any previous experience either, because there's high schoolers that do tech work.
Okay. So with phlebotomy, you're getting more patient interaction, but you're not getting more like medical.
Right. Like all we do is draw blood or collect specimens like urine or swabs, like COVID swabs and stuff. So we're not really doing anything besides drawing blood. Techs, they clean the rooms, they do EKGs, they help the nurses just with anything. So if you're looking for more medical, like you want to be more involved with the nurses and stuff, probably a tech job would be better. But also, something that I really like about working at Cox North, we're only psych and ER, so we have more downtime so I can do my homework, which is really nice. Whenever we're not busy, obviously work comes first, but but it's really nice I can do my homework there.
There is a little bit of downtime. I guess that's hard to come by if you're a tech, always running around.
Yeah, for sure.
For people that are kind of scared doing the first poke, what advice do you have for them?
I would say I feel like everybody's going to be nervous their first poke, no matter who it's on. It's like, okay, I'm about to stab someone with a needle. I hope I don't hurt them, but just be confident. Remember hopefully you practiced a little bit before on how to hold the needle and what to do after the initial poke, but just be confident and I would say it's kind of scary, but put the needle in faster rather than slower, because I feel like it hurts less if you go quicker, like stabbing wise. That doesn't mean stab it all the way in, but we do have a phlebotomist who does that every time, and she gets it every time. So, but she's also been doing it for like 30 years. So,
wow,
yeah,
that's quite a bit of time.
Yeah.
So I know there's something called like blowing a vein. What does that mean?
That's just where like you might go all the way through the vein, so you go through the top and the bottom of the vein, so you're not in it anymore, and it just starts swelling up, like, and then you don't get blood from there anymore usually, and if you do, it usually clots pretty quickly, because it's like your body's trying to fix what you just did to it, I guess. I don't really know the super scientific of it, but if you blow a vein, it gets really big, it probably will bruise, and some people are like, all my veins blow very easily, so just to give you a heads up. So.
And then how do you deal with like do you have like any guilt or anything if you do blow a vein or miss a poke? How do you deal with that?
Yeah, if I miss a poke, I'm always like, gosh dang it. And then I take the needle out, and I'm like, well, I have to poke you again. And most of the time, the patients are pretty nice. They're like, oh, that's okay. Especially if they're a hard stick, they know. And they're like, yeah, it's fine. And then I just poke them again. But whenever I blow a vein, sometimes you can't even tell you did until like you take the needle out and you go to put tape on it and a cotton ball. And then you're like, oh, that's blown. So you're just like, oh, gosh darn it, sorry. But it just happens sometimes. So, I mean, I don't feel guilty. Obviously, I don't want it to happen, but I'm like, well, that's part of it sometimes. Sorry.
Sometimes you're going to stick it, sometimes not so much.
Yeah.
So do you have like a favorite memory of working as a phlebotomist?
Not really a favorite memory in particular. The people I work with are usually pretty awesome, so I don't have any difficulties, but I don't have like a favorite memory or a favorite patient or anything, just because it's ER and psych, so.
So it's more so hanging out with the coworkers and seeing the patients that you enjoy.
Yeah.
So if you had to switch and do a different entry-level healthcare field, what would you go into?
I'd probably do a tech job.
Like in the ER techs?
Yeah, an ER tech. just because they get to see a lot of stuff. They're involved in more than I am because like I just go down, draw the blood, come back up. So I don't really know what's happening with the patients unless the patient starts talking to me and tells me. But I feel like the techs are more, they get to know the details, and I'm really what's that called when I'm nosy. I like to know stuff. So so I feel like the techs, that's a good job.
They get to know more of it. So
Yeah.
do you think the phlebotomy has helped you with your nursing program so far?
Yes, for sure. Like the clinical aspect, definitely. Especially starting IVs and stuff, because most of the girls are, of course, anybody would be scared to poke a patient. But since I do that for my job, I'm like, I'm not scared to do this part. It's just a different needle and different process for the IV versus like a butterfly needle. But also like in pharmacology, when we were learning about certain tests and stuff, I was able to be like, oh, I do that at work. So I kind of know a little bit about little things.
Oh, so it helps you on the clinical side and also on the education side a little bit.
Yeah, just a little bit. But definitely got to be careful though, because like blood is, some people can have infected blood. And like the other day, I've worked there for over a year now, and this is the first time this has happened to me, but I was helping a nurse. She was starting an IV, so I was picking up her trash and stuff, and she had the end of her, like the actual needle part from her IV. It was capped and everything, or like safetied, so the needle wasn't out or anything. But I went to put it in the sharps container, and blood from the needle dropped onto my forehead. Yeah, it scared me so bad because like that's so close to my eye, and I don't know what that patient could have HIV. I don't know. And so I was like, oh my gosh. And I went over and I scrubbed my forehead with alcohol pads. But I was like, that was crazy. So, I mean, you definitely got to be careful if you go into phlebotomy because bloodborne pathogens and stuff are very scary.
And you're dealing with blood all the time, so
Mhm.
if you're squeamish of blood,
Yeah, probably don't do this. If you don't like blood, if you don't like needles, if you don't like medical, if you're not a people person, this is probably not the job for you.
do you think you can get any of those skills, like the people person or not squeamish of blood, from doing the job?
Yeah, I guess you don't have to be a people person to do the job. Like, you don't have to talk to the patients. You just have to come in and say, like, hi, I'm Kylie. I'm with lab. I'm here to draw your blood. And then you don't have to, like, you say their name and date of birth. They say it to you. Or you look at their wristband, and then you don't really have to say anything else if you don't want. But, so I guess you don't have to be a people person. I don't really know about the blood, though, because it depends on how, like, I was never squeamish of blood, so if you are squeamish, like, if you're gonna pass out on the job, probably not. But if you're just a little bit and you can get used to it, then sure. But I don't know, it depends on person, I guess.
I guess the one thing that's pretty important is the pay. What are phlebotomists starting out at, and what do you think that they can cap out on?
I think I started at like 16 something. I can't even remember now, but right now I make like $17 and some change, I think, because I got like my year bonus or something. And because I get like a shift differential because I work overnight, or not overnight, evening shift. So I get like $1 more or something like that. So I make like 17 something, which is okay. But like if you're a single person, I don't know. It depends on your lifestyle, I guess, if you can swing that. But I don't know how much, like we have one lady who works and this is her full-time job. She's been working there for, she likes to say longer than I've been alive, but so she probably makes, I mean, more than me, of course. And she's certified, so she makes more, but I don't know how much, like the cap is.
So you think this is more of like a job you do for like a year or two and then move on to the future?
Well, I don't know, because like we have two people who have made it careers. They can. Especially if it's full-time, because I only work part-time, and I used to work PRN, so I wasn't making that much money, but I also I only work 2 days a week, so, yeah, but I think you could make it a career, like, because they do, so.
But with the people that you're working alongside, are the phlebotomists typically older or typically younger?
We have, like, a range, I think. Like, our overnight girl, I don't even know how old she is, but, I mean, she's not old, but she's definitely an adult. Like, you know? I don't know how old she is. Do you know how old she is?
I think like maybe in her 40s.
Okay, I was gonna say 40s or 50s. I didn't know.
We'll say 40s.
Okay.
It'll be nice.
40s. We've had some younger people, like 19, I think was the youngest.
So kind of like everyone from all walks of life is welcomed as a phlebotomist.
Yeah. At North anyway. I don't know anywhere else.
Okay, well, I think that's all I have. Thank you so much, Kylie, for coming in.
Thanks for having me.
You guys have a good one.